If you are over 60 and you have noticed that your legs feel heavy, tired, swollen, or that your feet are often cold even when the rest of your body feels warm, there is something important that most people in this situation are never told. Poor leg circulation after 60 is extraordinarily common, and it is one of those conditions that slowly worsens over years while being dismissed as simply getting older, right up until the point where it starts causing problems serious enough to demand attention. But here is what makes today's video different from anything else you may have seen on this topic. There is one specific exercise, a movement so simple that it can be done in a chair, in bed, or while watching television, that vascular surgeons point to again and again as one of the most effective tools available for improving circulation in the legs. Not a supplement. Not a device. Not a complicated routine that requires equipment. One exercise, done correctly and consistently, that works by addressing the actual mechanical and physiological reasons why leg circulation declines after 60. Stay with us until the end, because the explanation of why this particular movement works is the part that makes everything click into place, and once you understand it, you will never think about leg circulation the same way again. Before we get to the exercise itself, let's spend a moment understanding why leg circulation specifically becomes a problem after 60, because this context is what makes the solution make sense. The cardiovascular system is responsible for pumping blood from the heart through arteries to every tissue in the body and then returning that blood through veins back to the heart. In the lower body, this return journey is particularly challenging because blood in the leg veins must travel upward against gravity to reach the heart. In younger adults, this is managed efficiently by a combination of factors. The vein walls themselves are elastic and responsive. The venous valves, one-way valves inside the veins that prevent blood from falling back downward between heartbeats, are functioning properly. And crucially, the calf muscles act as a powerful pumping mechanism every time a person walks or moves, squeezing the veins between muscle contractions and actively pushing blood upward toward the heart. This is sometimes called the calf muscle pump, and it is one of the most important but least discussed mechanisms in the entire cardiovascular system. After 60, several of these mechanisms begin to decline simultaneously. The vein walls become less elastic and less responsive to the pressure changes that drive efficient blood movement. The venous valves in many people have experienced years of wear and begin to leak, allowing blood to pool downward rather than moving efficiently toward the heart. And perhaps most significantly, the calf muscle pump becomes weaker and less active, partly because muscle mass naturally decreases with age, partly because many people become less active and spend more time sitting or standing still, and partly because the neurological signals that drive muscle contraction become somewhat less precise with age. The result of all of these changes working together is that blood circulation in the lower legs becomes sluggish, blood pools in the veins, the legs feel heavy and tired, ankles and feet swell with accumulated fluid, and the tissues of the lower legs receive less oxygen and fewer nutrients than they need for optimal function. Over time, if this sluggish circulation is not addressed, it can contribute to more serious conditions including chronic venous insufficiency, varicose veins, and in more advanced cases, skin changes and ulcers in the lower leg that are extremely difficult to treat once established. Now let's talk about the exercise, because everything we just discussed leads directly to understanding why it works. The exercise is ankle pumping, sometimes called ankle circles or ankle flexion, and the specific version that vascular surgeons recommend as most effective for leg circulation is what is known as dorsiflexion and plantar flexion. In plain language, this means repeatedly flexing the foot upward toward the shin as far as it comfortably goes, holding briefly, and then pointing the foot downward away from the body as far as it comfortably goes, alternating between these two positions in a steady, rhythmic pumping motion. Each complete cycle of up and down takes roughly 2 to 3 seconds, and the recommendation from vascular medicine specialists is to perform this movement continuously for 2 to 5 minutes at a time, multiple times throughout the day, particularly after periods of sitting still. The reason this specific exercise works so powerfully on leg circulation comes directly from the anatomy and physiology we discussed. When you flex your foot upward, the muscles of the calf contract and the muscles of the shin engage, and this muscular contraction physically squeezes the veins running through the lower leg, pushing blood upward toward the heart in exactly the same way that walking does. When you then point the foot downward, those muscles relax, the veins refill with blood from below, and then the next upward flexion pushes that blood upward again. Each repetition of this motion is essentially one pump of the calf muscle pump that would normally happen during a walking step. For someone who is seated at a desk, on an airplane, in a waiting room, or on a sofa for an extended period, performing ankle pumps reactivates this pump mechanism without requiring standing, walking, or any other movement that might be difficult or impractical in the moment. The additional component that makes ankle pumping particularly effective is the engagement of the foot and lower calf, which is where the venous return system is most vulnerable to pooling. When blood pools in the leg, it tends to pool in the lowest points first, which are the ankles and feet. Ankle pumping specifically targets this region, and the rhythmic compression and release of the veins in precisely the area where pooling is most likely to begin makes it uniquely effective compared to exercises that engage only the upper portions of the leg. This is why vascular surgeons specifically recommend ankle pumping rather than simply leg raises or thigh contractions when addressing lower leg circulation. The frequency and timing of the exercise matters as much as the movement itself, and this is something that most general advice about leg circulation exercises fails to specify adequately. The calf muscle pump only maintains its benefit during and immediately after activation, meaning that a single bout of ankle pumping in the morning does not provide circulation benefit throughout the rest of the day. What research on venous return physiology suggests is that short, regular sessions throughout the day are significantly more effective than 1 or 2 longer sessions. The practical recommendation from vascular specialists is to perform ankle pumps for 2 to 3 minutes at the start of any period of prolonged sitting, and then to repeat them every 30 to 45 minutes throughout any extended sitting period. This rhythm closely mirrors the natural intervals at which the calf muscle pump would be activated by walking in a person who is physically active throughout the day. For people who find the basic up and down motion of ankle pumping straightforward, adding ankle circles provides an additional dimension of circulation benefit. Ankle circles involve rotating the foot in a full circular motion, which engages the muscles of the lower leg from more directions and activates a slightly broader range of venous pathways in the foot and ankle. The combination of ankle pumping and ankle circles, alternated throughout a sitting period, addresses the widest range of venous pathways in the lower leg and provides the most comprehensive activation of the calf muscle pump mechanism. Let's also talk about other simple practices that complement ankle pumping and together create a more complete approach to improving leg circulation after 60. Elevation is one of the most powerful adjuncts available. When the legs are elevated above the level of the heart, gravity assists venous return rather than opposing it, allowing the veins to empty more efficiently. Elevating the feet for even 15 to 20 minutes while resting, lying on a sofa or in bed with the feet propped on pillows so they are higher than the torso, can provide noticeable relief from leg heaviness and swelling and directly complements the circulation benefits of ankle pumping. The combination of ankle pumping during sitting and elevation during rest periods addresses leg circulation from 2 complementary angles that work synergistically. Hydration is another factor that directly affects the viscosity and flow characteristics of blood in the leg veins. Dehydration causes blood to become slightly thicker and more viscous, which makes it harder for the venous return system to move it efficiently upward against gravity. Many older adults are chronically mildly dehydrated, partly because the sensation of thirst becomes less reliable with age, meaning the normal internal signal that prompts fluid intake becomes less sensitive and less accurate. Maintaining adequate hydration throughout the day, aiming for consistent water intake rather than drinking only when thirst is felt, supports the fluidity of blood in a way that makes the venous return systems work somewhat easier and complements the mechanical benefits of ankle pumping. Compression stockings are another tool that vascular surgeons frequently recommend alongside exercise for improving leg circulation, and they work on a principle that is complementary to ankle pumping rather than redundant with it. Graduated compression stockings apply external pressure to the legs that is greatest at the ankle and decreases moving upward toward the knee or thigh. This graduated pressure helps prevent blood from pooling in the ankle region and assists the venous valves in preventing backward flow between the contractions of the calf muscle pump. For people with significant venous insufficiency or chronic leg swelling, compression stockings worn during waking hours can make a meaningful difference in both comfort and long-term vein health. They are particularly valuable in combination with regular ankle pumping because the compression provides a constant baseline of venous support while the ankle pumping provides the active pumping mechanism that moves blood upward. Walking remains one of the most powerful long-term interventions for leg circulation after 60, and it is worth discussing in relation to ankle pumping rather than separately. Let's also spend a moment on something that many people don't realize has a direct connection to leg circulation, which is the role of the lymphatic system. The lymphatic system runs parallel to the venous system throughout the body and is responsible for draining excess fluid from tissues back into the bloodstream. In the legs, lymphatic drainage works closely in concert with venous return, and when venous circulation is sluggish, the lymphatic system has to compensate by working harder to prevent fluid from accumulating in the tissues. When both systems are working efficiently, fluid balance in the lower legs is well maintained and swelling is minimal. But when circulation is poor and the calf muscle pump is underactive, both the venous and lymphatic systems fall behind, and fluid accumulates in the tissues of the ankle and foot, producing the characteristic swelling that many people over 60 experience by the end of the day. Ankle pumping benefits the lymphatic system as well as the venous system, because the same muscular contractions that squeeze the veins also compress the lymphatic vessels running alongside them, helping to drive lymphatic fluid upward and preventing the tissue accumulation that leads to swelling. The skin and tissue health of the lower legs is another dimension worth understanding, because it illustrates the long-term stakes of maintaining good leg circulation at this age. The skin and soft tissues of the lower legs depend on adequate circulation to receive the oxygen and nutrients they need for cell maintenance and repair. When circulation is chronically poor, these tissues operate in a state of relative oxygen deficiency and reduced nutrient supply, which impairs their ability to heal from minor injuries, maintain normal skin integrity, and resist infection. This is why people with chronic poor leg circulation often notice that the skin of their lower legs becomes thinner, more fragile, and more prone to minor injuries that heal slowly. In more advanced cases of venous insufficiency, the skin can develop a characteristic brownish discoloration from iron deposits left by red blood cells that have leaked through damaged capillary walls, and in the most severe cases, ulcers can develop that are extremely difficult to heal because the tissue they sit in is receiving inadequate circulation to support the healing process. Preventing this progression starts with maintaining the active circulation that ankle pumping provides, and it starts before the advanced stages rather than after them. Temperature regulation in the feet and lower legs is another area that is directly affected by poor circulation and that ankle pumping can meaningfully help. Many people over 60 notice that their feet feel persistently cold even in warm environments, and this cold sensation is one of the most common complaints related to poor lower extremity circulation. Ankle pumping, by activating the calf muscle pump and improving the overall circulation through the lower leg, can increase blood flow to the feet and improve temperature regulation, often producing a noticeable sensation of warmth in the feet shortly after beginning a pumping session. For people who regularly experience cold feet as part of their poor circulation picture, this warming effect of ankle pumping is often one of the most immediate and tangible signs that the exercise is having a real physiological effect. One more practical point worth making is about the position in which ankle pumping is most effective. While ankle pumping can be performed in any seated position and provides benefit regardless of leg positioning, sitting with the feet flat on the floor and the knees at approximately a right angle allows the calf muscles to engage most fully during the pumping motion. Sitting with the legs crossed or with the knee significantly bent reduces the efficiency of the calf muscle engagement. And performing ankle pumping while the feet are slightly elevated provides the additional benefit of partial gravity assistance that makes it easier for the pumped blood to travel upward toward the heart. For someone who spends a significant portion of their day seated, combining the correct seated posture with regular pumping sessions throughout the day and elevation during rest periods represents the most effective practical application of everything we have discussed. Walking activates the calf muscle pump through the natural heel-to-toe rolling motion of a walking step, and regular walking throughout the day is the physiologically ideal activity for maintaining venous return. However, for many people over 60, walking consistently enough to provide adequate circulation benefit throughout the day is limited by pain, fatigue, arthritis, balance concerns, or the practical constraints of indoor or sedentary environments. Ankle pumping provides the same calf muscle pump activation as walking but in a form that can be performed in any seated position, making it an accessible alternative for periods when walking is not practical and a complementary tool that extends the circulation benefit of walking into the seated portions of the day. It is also worth understanding the connection between leg circulation and overall cardiovascular health at this age, because poor leg circulation is rarely an isolated problem. It is almost always part of a broader picture of cardiovascular aging that includes changes in arterial stiffness, venous valve function, cardiac output, and the efficiency of the microcirculation throughout the body. Addressing leg circulation through ankle pumping and the complementary strategies we have discussed is therefore not just about comfort and symptom relief. It is about maintaining the health of the venous system in a way that reduces the risk of more serious complications, reduces the demand on the heart and lymphatic system to compensate for inefficient venous return, and preserves the functional independence of the lower limbs over time. Before we close, it is important to say clearly that while ankle pumping is a safe, evidence-supported exercise that is appropriate for most adults over 60, and while the information in this video is consistent with recommendations from vascular medicine specialists, this video is for general educational awareness only and is not a substitute for evaluation and advice from a qualified healthcare provider. If you are experiencing significant leg swelling, pain, skin changes, or any symptoms that have developed rapidly or concern you, these should be evaluated by a doctor rather than managed with exercise alone. Some causes of leg swelling and circulation problems in older adults require specific medical treatment, and distinguishing between these causes and making an appropriate treatment plan requires a medical evaluation that goes beyond what general educational information can provide. If this video gave you a practical and science-backed tool for addressing something that has been affecting your comfort and mobility, please share it with someone over 60 in your life who might benefit from knowing about this, because this is the kind of specific, actionable information that most people never receive clearly enough to actually use. If you found this video helpful, please like it and subscribe to Dr. William Heart Health for more videos like this every day.